And then some people around here, Tom Farley, who I guess I'm competing with, or his group, led a very early group that was looking at the future vision of the healthcare system in the city. So contextually, right, we were all running around every day trying to deliver healthcare on the streets, find bandages, find prescription pads, do whatever we could in a very reactive mode. But it takes sort of your public health partners, if you will, who have strategic thinking to sort of step back and say, well, where are we going? Because we can't do this forever. And, what the Public Health Service did in concert with some local people like at the Louisiana Public Health Institute, and Tom took a really lead role in that. Jeanette and I had a chance to participate in that, as well as many other folks. And it was, the process was, for that framework, was really just to put everybody in a room, people who would normally not talk, for varieties of reasons, and say, what kind of healthcare system should we have when we walk away from the tents? What would be nice? Do we want to go back to having hospital-based healthcare that's very centralized, that's very doctor-focused, or do we want to have a system that's very patient-focused and decentralized and in communities that's primary care emphasized and focuses on prevention and health education? And that is what we concluded. That group of folks who signed off on that is the hospitals and the nursing homes and other groups that you might not think would want to emphasize primary care. So it was a pretty big thing to actually turn the ship in that way and create that pie-in-the-sky vision, a blue sky dream, if you will. There have been several other groups working on redesigning the healthcare and sort of thinking about the future, and I'm going to have an editorial comment about that for you all. This is my diagram that attempts to show how these groups have overlapped or fed into each other. One of the biggest lessons that I have learned in the last 6 weeks is that long-term planning is really great, but if you don't take care of the short term, then it's really difficult for people to think into the future. And that's like a statement of the obvious. But we learned that with residents, right? If we feed the residents or students lunch, they pay more attention in class because they're not worried about how they're going to go find something to eat. Well, if we can figure out how to keep the health system intact in the next year, then we can think about the fun stuff that's going to happen in a year or two. The downside to all these groups is that I think we overshot. I think we thought really, we're still working, but I think we're way blue sky about the big picture and where we can go. There's not been enough attention to the transition between the tents and the, interoperable health record, health system thing, and how everybody has insurance. We could talk a lot about whose job that was, how that's happening. I think there's some good stuff that's happening in that area that DHH is leading. But as an infrastructural issue, God forbid, for the next disaster, I think no city in the country in modern times is adequately prepared for total destruction of their infrastructure. And the government, the feds, are not prepared for that. And so no one really knows how to get from A to Z. We could get from A to B and maybe to C, but that whole middle part, no one can seem to figure out how to allocate the money. All right, so just to recap, the attributes of success that I saw that were remarkable to me and a lot of individuals, and that I think served them well in this environment, were creativity, boldness, flexibility, strength, endurance, and being able to make decisions with very little data, as well as a vision for what could be, even tomorrow, much less in the future. A couple of very practical things that to walk away from, and that I think would have been quite helpful for our organization and for any organization. And that the first is personal capital. So what I mean by that, for those of you who may not be familiar with that term, is having a relationship with somebody. So I have a relationship with Raina, and we know each other. So when I email her and ask her to do something for me, she knows who I am, and she knows that she can, I hope, trust me, and that what I'm asking for is significant, or I wouldn't bother her. Well, when the whole infrastructure falls apart, and if she were running, let's just say, the federally qualified health centers in the city, and I'd never met her before. She didn't know who I was, but we were the two people on the street trying to prop up a health system. We'd have to spend some time building our own personal capital to trust each other before we could actually build a health system. It's just how it happens. And it's one of the reasons that things fell apart, because those of us in academia, LSU and Tulane, who provide a lot of the safety net care for the city, we were doing care for about 250,000 people in this city. But we didn't know any of the other safety net providers in the city. We didn't mingle. And so when this storm hit, and then everything was washed away, there was a few of them here, and a few of the patients were all gone, but we were all the providers left, and we were trying to meet each other. It was like speed dating, like, hi, how you doing, what you doing, trying to figure out who you can interact with. This happened also at the very high levels. So for those of you that are very ambitious, personal capital that you need to build when you go to become a dean of an organization, you need to look at your books and you go, okay, where do I get most of my revenue from? Okay, well, this entity, the VA supplies 30% of my revenue, so I need to spend 30% of my time talking to people from the VA, or whatever. It's an oversimplification, but it's a business model of how you interact. And I know that some of our leadership didn't know the VA folks. I know some of the LSU leadership didn't know VA, even though they had contracts with them. They know them very well now. But it's a little thing to have lunch with somebody occasionally, and especially when you enter an organization. Go around, shake hands, have lunch, how are you, nice to meet you, get to know the person. Not to be, not to awfulize and say there's going to be some natural disaster, but it's always good to put that in the bank. It's just a simple thing to do. This Uber chief is second. In normal times, you need all those leadership skills are great in anybody, but not always. Sometimes you don't want a terribly bold leader. You want someone who's a little bit more A to Z and can manage things a little more thoroughly than sort of think off the cuff and all that. We don't have because maybe we're thin, but I know in the School of Medicine and in the hospitals, we didn't have really good Uber chiefs, it's not really the right word, but like a person who's kind of like in the wings, that's the emergency person. So you have a regular person running things who has all those strong interpersonal skills, who knows how to talk to people and be diplomatic, and then you have this other person who has the understanding of the organization, so knows the finances, knows who the people are, understands how things work together, and can be the on-the-ground person in a crisis while the other person's away trying to really deal with the bigger picture. We only have sort of one person in charge of every kind of role. And for example, I don't know, Jeanette, who you have that's your backup, like for the Women's Health Center. You probably do now. You may have before. But even in my section, I have a person who knows a lot about the section, but she's definitely not. I'm more of the crisis person. She's definitely more of the non-crisis person. And now that we understand that and we've come to terms with it, I've told her explicitly, you will never, ever, ever work a storm. You must always leave, and you must always take the information that we need about how to find people and who's on the schedule and who gets paid what, so we can recreate everything, God forbid, if we ever have to do it again. And I'll stay in the hospital because that's really where I belong. I know our chairman doesn't have all that, and et cetera. And it just slowed us down so immensely because we had one person was trying to manage the code, but they were also trying to manage the rest of the finances and the vision and the whole thing. It was really too difficult to do. And then the last thing is the plans with layers of backup. This is helpful in the absence of good leadership. So if you don't have the strong leadership on the ground or any backup leadership, then if you have good plans, then you can sort of get through that. And that includes a strategic plan that paints a picture of the worst thing that could happen. All the scenarios are thought through. And then this is my disaster planning advice, which I think one of our problems last year was that we had a plan for the storm. It was that Bob would call Jim. But the phones didn't work, so Bob couldn't call Jim, and Jim, was on a houseboat, and Bob was in Alaska, so it was like kind of a problem because then there was no, Bill and Fred, and there was no text messaging, and there were no layers of backup. Very simple things to think about, just this, a bunch of if-then statements. But if you're away, then what happens? And if that's not there, then what happens? Very simple strategic planning, proactive instead of reactive. And I think that's it. So, thank you.